It's time to take a look at some words or phrases you may have heard, but don't quite understand. Over the next few minutes, our hometown health specialists help explain Barrett's esophagus, astigmatism, chronic venous insufficiency, the difference between Botox and derma fillers, and a better understanding of what pain really is.
Answer is a deterioration in the lining of the esophagus due to chronic acid reflux.
What is Barrett's esophagus?
Very good.
Well, Amanda Dunn, a nurse at Advanced Gastroenterology and Surgical Associates, explains.
Gastroenterology covers pretty much everything from mouth to the other end and everything in between. We deal with the esophagus, stomach. We also deal with the small bowel, colon, your gallbladder, pancreas, and liver are the main organs that we see. We treat a bunch of different diseases and disorders of any of the said organs. Anatomy kind of goes your esophagus, and then there's a little muscle flap called the lower esophageal sphincter, and then it goes into your stomach. Sometimes there's a weakening of that muscle or sphincter, and so the acid from your stomach can actually reflux up into your esophagus and cause damage. There's also, over time, chronic reflux can lead to something called Barrett's esophagus. And basically the best way to explain that is when you look, if you were doing the procedure and look, the esophagus kind of looks white in color on the inside. The stomach looks pink, and over time from the acid splashing up, the esophageal tissue actually starts to change. So when the doctors go down during the endoscopy, they'll see pink extensions up into the esophagus, and they biopsy that as something called Barrett's esophagus. It actually puts you at higher risk of developing esophageal cancer. Some of the lifestyle factors that affect reflux, or a lot of people refer to it as GERD, gastroesophageal reflux disease. The most common, smoking, can play a factor into it. Also obesity is a common factor into reflux.
According to Johns Hopkins University, Barrett's esophagus patients are up to 125 times more likely to develop esophageal cancer, claiming an estimated 12,000 lives in 2010. Early detection for men with chronic acid reflux in particular should be tested by a physician for Barrett's. AGSA specializes in the diagnosis and the treatment of reflux and other gastrointestinal conditions. To learn more, visit the Advanced Gastroenterology and Surgical Associates Specialist Directory page at yourhometownhealth.com.